Well, thank you very much, Sharon. So let's go ahead and get started. So this is on broken bones, and I will tell you right off the bat, you're going to learn a lot more than just about broken bones. This actually is going to be a hair, teeth, nails, skin, and bones webinar. Okay, so let's find out why. So first of all, I just want to say that this information is intended for healthcare professionals only. It's not necessarily the opinions of Standard Process or MediHerb. It hasn't been evaluated by the FDA. I'm not treating anything or claiming to diagnose anything, but I do want to let you know that you're in very good hands. I put a tremendous amount of time and effort into the clinical research that I do. So let's talk about bones and broken bones. And in order to understand broken bones or any issues with our bones, we need to understand how bones work. So we're going to start way back at the beginning in our childhood years. So during our childhood and teenage years, there are more bone deposits than withdrawals. And that makes sense because with this process, it allows our body to grow. So our skeleton expands, we get taller. And as we grow older, so just going back, just backtracking, women by the age of 18 and men by about the age of 20, I think 85 to 90% of our bone mass is accumulated by that age. But then as we get older, our bones become thinner. And what happens is the original process that we had of more deposits than withdrawals gets reversed. And now we have more withdrawals than deposits of bone. So the result is that our bones lose calcium, they become lighter, so they're less dense and they're more porous. And the result is that this makes our bones weaker and increases the chance that they might break. So I would be remiss if I just gave you some supplements for broken bones without giving you the entire picture. And I think it'll help you to remember how important it is to take care of our bones properly. So broken bones can be the result of an injury, but they also come as a result of weak or brittle bones. So it's not just the aging process, but it's how we feed our bones. And I'm going to talk about that in detail. But also, and I think this is really important, is medications contribute to weaker bones as well. So it's a condition known as medication-induced bone loss. So anyone who's dealing with osteoporosis or trying to get ahead of it needs to be very cautious about the approach that they're taking to building their bones. And the biophosphonates, which are the medications that are used for osteoporosis, apparently they stop the bone withdrawal process, but they also stop the deposit process. So that means that our bones aren't being refreshed with the minerals that they need. And that's why, and this is the scariest part, is that people that are on these medications for osteoporosis may end up with fractures in the femur. And the femur is considered one of the strongest bone and one of the hardest bones in the body to break. So it's normally one of the strongest bones in the body, but because of being on this medication for osteoporosis, we end up losing the withdrawal process, but also the deposit process of all the minerals that make our bones strong. In addition, there are plenty of medications that contribute to bone loss. So I put some of them in here. So steroids or glucocorticoids can do that. Drugs that are used to treat epilepsy will weaken our bones. Gonadotrophin releasing hormone agonists that are used for endometriosis, female infertility, or prostate cancer also weaken our bones. And then any women that have had breast cancer and have gone the route of of aromatase inhibitors, those also will weaken the bones. My computer just got stuck. There we go. Okay. Here are other medications that may cause bone loss. Antacids. So many people are on antacids because of, it could be gastric reflux, heartburn, gas and bloating, but those weaken our bones. And a lot of people think that they're taking antacids for their bones. It's like, my doctor told me to take this. Please keep this in mind, that this is a medication that is known to cause bone loss. Chemotherapy drugs, it continues to go on and on. Heparin, which is used to prevent blood clots. A lot of people have been put on heparin since COVID as well. So keep that in mind. If you're on any of these medications, you need to pay attention to your bones. Methotrexate is another one for cancer and rheumatoid arthritis. And the medications that are related to diabetes also can weaken our bones. So the point, or the case I'm trying to build, the point I'm trying to make, is that our bodies need to have the full natural process. Bones that are being built with new minerals, while old minerals are reabsorbed into the bloodstream. So we've got that withdrawal and that deposit process taking place naturally and in a way that's strengthening and building our bones. So the information today is going to apply not only to broken bones, but to bone fitness in general. This is going to make our bones stronger, okay? So what we're going to do is we're going to take care of our bones based on what our bones are made of. So the products that I have researched heavily are the ones that I think are the most critical for bone health or broken bones. But they're also going to be fantastic for fingernail health, hair health, skin health, and teeth health. And I'll take each one in detail, but I'm going to start with calcifood wafers, or the powder, Calma Plus and calcium lactate, Veggie Pro, Medi-Herb Gotu Kola Complex, and Medi-Herb Nettle Leaf Extract. So again, we need to feed our bones based on what our bones are made of. And our bones consist of 1/3 water, 1/3 protein, and 1/3 mineral salts. And the largest mineral is going to be calcium, and that's in the form of hydroxyapatite, which comes from animal bones. So now I'm going to backtrack for just a minute. Keep in mind that every organ system, every system of the body is dependent on hydration in order to work efficiently, including our bones. And here we go. So it turns out, here's a recent study conducted by New York Hospital and Cornell Medical Center, and this was with over 3,000 patients. They found that 75% of these 3,000 subjects were experiencing net fluid loss from chronic dehydration. It is therefore no exaggeration to say that America is indeed facing a dehydration crisis. Okay, why is that? How many of us are drinking water? How many of us are substituting our water with sodas, with caffeinated beverages, such as coffee, obviously? One thing that's not mentioned here too is beer. I know of people that just insist on, they say, oh, well, Coors Light is mainly water, and that's how I get my water, okay? And then too, that many of us confuse our brain signal for thirst as a need for food or for need for rest, because one of the symptoms of dehydration is fatigue. And you don't want to wait until you're thirsty. And this is something that I learned when I was a cyclist. I used to be in 100-mile bike races. And this was one of the things that they drummed into us over and over again, is you drink before you're thirsty. Because if you wait until you're thirsty, you are already dehydrated. In addition, dark colored urine is another good symptom of dehydration. So we want to pay attention to those symptoms of dehydration. And then we can also look at blood values too. The blood values that are most commonly associated with dehydration are our electrolytes, mainly sodium and potassium. Any of the red blood cell values that include reticulocytes, hemoglobin, and hematocrit. And then the kidney function. So keep in mind how important kidney function is for the health of our bones. And the blood values that are associated with dehydration are FUN and creatinine. Okay, so we've talked about dehydration and how that is a big risk, and that's 1/3 of our bones. So now let's talk about protein. You would think in America that there's a craze of protein consciousness and that protein would never be an issue in the United States. But here's a new study that was published in the Journal of Nutrition, Health, and Aging that shows more than 1 in 3 adults that are over the age of 50 are missing the mark on protein. And of those not meeting their protein intake, 1/3 were up to 30 grams of protein short per day. And a 160-pound healthy adult who needs at least 58 grams of protein a day, this is more than half of their daily needs that they are missing in protein. So here's the second third of our bones is protein, and how 1 in 3 Americans are considered deficient in protein. Therefore, here's an end result. The majority of Americans do not consume the current recommended dietary allowance for calcium, and the lifetime risk of osteoporosis is about 50%. Okay, so now we're talking about bones that are weak to begin with. So the incidence of fracture is going to go up. So again, it makes sense that to help build our bones from within, we need the essential building blocks of strong bone tissue: hydration, protein, and that very important mineral complex. So again, these are the products that I'm going to talk about, and I'm going to break them down. I'm going to start with calcifood first. And I really started studying calcifood because I never thought of using it for arthritis. And I've had such positive feedback from doctors that have started to use it for arthritis and not just broken bones. But it turns out that it's so important for the bone matrix, and I'm going to explain why. Because we are feeding our bone the 3 components that it needs to remain healthy. So again, hydration is going to come in the form of bone marrow and collagen, which is naturally occurring in calcifood. Protein is coming in the form of type 1 collagen protein that is naturally found in calcifood wafers. And then minerals. The calcium matrix, the hydroxyapatite crystals that are only coming from animal bone are naturally occurring in calcifood wafers or calcifood powder. And keep in mind, we're not just talking about bones, we're talking about our nails, our teeth, our hair. And here we go, 70 to 80% of the mass of dentin and enamel in teeth is coming from hydroxyapatite, which is only found in the animal bone and which is naturally occurring in the standard process calcifood wafers. Bone marrow is a source of electrolytes, so it's going to be really important. Remember, the blood value that's associated with dehydration is electrolytes, and electrolytes are going to naturally hydrate the body. And this is a 2019 PubMed study, and I have all of my references at the end that'll be available to everyone. A double-blind placebo-controlled 8-week study. Remember, it takes 8 to 10 weeks, sometimes longer, for bones to heal from a fracture. It depends on the type of fracture and the type of bone. So this was an 8-week study, and where 69 women found that supplementing with collagen helped improve hydration, 1/3 of our bone, skin elasticity, roughness, and density. So again, we're not just feeding our bones, we're feeding our hair and our skin, our nails, and our teeth. Type 1 collagen, which is naturally occurring in calcifood, is the most abundant collagen in the human body. It's found in tendons, skin, artery walls, the cornea, so it's great for our eyes, the endomysiosum, surrounding muscle fibers, fibrocartilage, and the organic parts of bones and teeth. Type 1 collagen is particularly important in bone, skin, and connective tissue. And one thing I want to say about our bones is it is connective tissue, but it's a very special type. It's the only type of connective tissue in our body that is mineralized to give it strength. Okay, so anything that's good for connective tissue is going to be good for our bones. So we're talking about type 1 collagen. Again, this is the form of protein that's found in our bones and naturally found in calcifood wafers. And I put this in here because osteogenesis means forming new bone, but there are diseases known as osteogenesis imperfecta, which is where, unfortunately, it's a connective tissue disease where people fracture with no apparent cause. So obviously, connective tissue is going to be very important for our bones. In addition, so we've talked about protein and we've talked about hydration, but it's also, calcifood is going to be an excellent source of all minerals. You're getting the calcium matrix of the hydroxyapatite crystals naturally occurring in animal bone. Never, ever, ever, please don't ever confuse it with bone meal products, which are considered steamed or dead. This is more of a raw product with all of the beauty of the bone marrow and the gelatin and all the other goodness that we've talked about still naturally occurring in there and readily available to the body. It's also a source of keratin. So keratin is what our hair is made of. And I'm just going to share with everyone, the last time I was at the hairdresser, she told me, because I've been taking calcifood religiously since I've been doing research on it, because I thought this is so important for my bones as well. And she told me, Kim, your hair has changed in such a good way. It's no longer breaking off. It is the strongest I've ever seen. So there you go. One of the practitioners I was working with in Napa has been taking calcifood, and she shared with me, she said, Kim, my fingernails are growing so fast, I'm now having to cut them once a week. They've gotten really strong and really healthy. Again, like I said, this isn't just about broken bones today. So calcifood is also a source of keratin, glucosamine and chondroitin sulfate, and gelatin. Consider it a bone broth in a tablet or powdered form. Keratin is a protein that makes up our hair, skin, and nails. It's also found in our internal organs and glands. So here is a study. I thought this was really interesting, as I never thought of, we tend to think of glucosamine sulfate as being good for arthritis, which it is, and that's probably why calcifood wafers work so beautifully for arthritis. But it turns out that it's excellent for fractures, that it affects the first stages of bone repair and increases osteoblastic cell lining and bone trabeculae. And new bone formation and osteoblast lining were significantly higher in the glucosamine treated group at week 1. Apparently, it's the most important part is getting it in your body as quickly as you can. Here we go, talking about connective tissue. Remember, our bones are a special mineralized form of connective tissue. Surrounding connective tissue is more cellular and vascular, which means it's going to help improve circulation. And the newly formed bone trabeculae were present in greater amounts in glucosamine-treated group compared to the control group at weeks 1 and 4. Helps keep cartilage around the bones intact, so it also provides strength to the structure that keeps our bones in place. Helps prevent cartilage from diminishing over time and age. Chondroitin sulfate is a major component in many connective tissues, including cartilage, bone, skin, ligaments, and tendons. So I would also recommend calcifood for any kind of tendinitis, plantar fasciitis, anything dealing with connective tissue. Calcifood wafers is going to be excellent. Chondroitin sulfate also contains a glycosaminoglycan, which is a major component of bone matrix, responsible for many of the important biomechanical properties of cartilage, such as resistance and elasticity. One wafer of calcifood will give you 100 milligrams of calcium. And a tablespoon of the powder will give you 600 milligrams of calcium. So the suggested use is either 6 wafers or 1 tablespoon of powder daily for broken bones for 3 months. Now, I don't have any broken bones currently. I have had broken bones before, but ever since I've done this research on calcifood and arthritis, and then certainly with broken bones, I've just decided that this is something I'm going to stay on for good, just to keep my bones as strong and healthy as possible. Now, you may wonder, well, 600 milligrams of calcium doesn't seem like a lot, and we'll actually talk about usable calcium versus calcium that your body cannot digest a little bit later. The next product that I want to talk to you about is a product that you may not be that familiar with, but I think it's critical. In fact, this is going to be the first line of support in addition to calcifood wafers that I'm going to recommend for anyone who has broken a bone, and that is Calma Plus. And it does contain calcium lactate, but its main function is parathyroid support. So you see, it's only 50 milligrams of calcium lactate. And like I said, the rest is parathyroid support. So I'm going to explain to you why parathyroid support is important when you have broken bones. And before I do that, this is the calcium lactate showing that it's more acid, which helps break down the calcium than most forms of calcium that are available on the market. So most calcium lactate is a pH of 7, which is neutral, which makes calcium very hard to digest. Our calcium lactate is at a pH of 5.2, which makes it much easier to break down. Okay, so here's the information on the parathyroid. The endogenous parathyroid is the primary regulator of calcium and phosphatate metabolism in the bone and the kidney. Remember, the kidney bone blood values were discussed in hydration a little bit earlier. One of the 3 main components of bone is hydration or water. So the parathyroid has a net effect of stimulating new bone formation, leading to increased bone mineral density. So its main function is to increase calcium levels when they're too low. And our parathyroid glands actually have calcium sensors. So the interesting thing is we have calcium that is in our bones, and we also have calcium in our bloodstream. So our bones will act as a calcium reservoir, and they'll release calcium into the bloodstream when our blood levels are low, but they'll also uptake calcium when they're high. Calma Plus acts to balance the parathyroid hormone, whether too high or too low. And this is going to be critical because it's going to be very important to make sure your parathyroid gland is working when you drastically need to have that calcium. You need that mineral matrix put in your bones as quickly as possible. The suggested amount of Calma Plus is 6 daily for 3 months. And then you can switch to calcium lactate if you'd like. And I wanted to break this down for everyone too, so you don't have to do any arithmetic around it. 6 calcium lactate tablets. So now we're talking about calcium lactate. We've gone from Calma Plus to calcium lactate. So 6 calcium lactate tablets will give you 250 milligrams of calcium, or the powder. 1 tablespoon of calcium lactate powder gives you 800 milligrams. It takes 20 tablets of calcium lactate to be the equivalent of 1 tablespoon of the calcium lactate powder. So my recommendation, especially if you're dealing with bone health, need for mineral matrix in our bones, is I would take the powder. Now, the powder does not taste good in water. I'll be honest with you. I've had calcium lactate powder sit in my cupboard and not take it just because I couldn't stand the taste of it in water, because it tends to be pretty tart. So what I found is that mixing it with a little bit of juice, and the juice that I found that works beautifully, and I have no problem taking calcium lactate powder now, is taking it in, it's called Simply Limeade, but I also found it works quite nicely in black cherry juice. So find a nice juice to put your calcium lactate powder in. And calcium lactate is good not just for our bones, but it happens to be excellent for our immune system. And that's why it's in so many of our immune products. And my recommendation is if you start to feel like you're coming down with a cold or a flu, this is what I personally do. I take a tablespoon of calcium lactate powder and I just mix it in juice. And then if I have, feel like if I'm really tired and feel like I'm in need of a really good sleep, need something to put me to sleep very gently and quickly, calcium lactate powder does that too. Happens to be great for hyperactive children. So I do remember one of our speakers saying that what he would do is he would, if his kids were running around the house and super hyperactive, he would just put calcium lactate powder in some lemonade, which also would work. And, within a half an hour, his kids would just totally calm down. So wonderful stuff. And when you're dealing with broken bones, my recommendation is 1 to 2 tablespoons daily. You can use the tablets, but you have to take a lot more tablets. And I think one of the biggest issues for people is they don't want to take that many tablets. And we talked about the pH already. I did want to say too that the lactate, and I'll talk a little bit about calcium lactate versus other brands of calcium that are out there, including Tums, which leads to osteoporosis or poor bone health, is that the lactate is metabolized to bicarbonate in the liver. So please do not confuse this with calcium carbonate, very different product. Calcium bicarbonate exists only in our blood and in rich spring water. It's one of the minerals that gives water, mineral water, its wonderful taste, or spring water. Again, it's not to be confused with calcium carbonate because that's made from limestone or rock. It has a very high calcium content, up to 40% calcium, but it has a very low bioavailability rate. In fact, doctors have been recommending more and more amounts of calcium. I know of people that have been taking 2,000 milligrams of calcium a day in the form of calcium carbonate because their doctors want to make sure that they are getting enough calcium. What happens to the rest of the calcium? Well, you can learn about that in a webinar that I have on all the different forms of calcium. But one of the things that it can do, this bad calcium that makes heart disease worse because it ends up as plaque in our arteries, but also this is something I've heard from chiropractors over the years, is that you'll actually see calcium deposits in between the ribs on an X-ray. That's what's happening with the calcium. When it's not bioavailable, the body is finding another use for it. And unfortunately, it's not usually a good use. So it's actually better off for you to use a lower calcium amount that has a very high bioavailability rate, which the calcium lactate and most certainly the calcifood wafers would have. It only requires one biochemical step to become calcium bicarbonate, which is what's found in our blood. And this is an important piece I wanted to make, is the fact that so many people think because of the name, they think, oh, well, it's got lactose in it. It does not. It is lactose-free, dairy-free, casein-free. You can give it to anyone who is allergic to milk products. It is not going to be an issue. It's the natural product of lactic acid manufactured by the fermentation of beet sugar. And again, although the calcium content isn't very high, what really matters is what your body absorbs. So this is going to be true not only for the calcium lactate and the calcifood, but also the Calma Plus that we've already talked about. Okay, so we've talked about hydration, and we've talked about protein, and we've talked about minerals. We're going to go back to protein because I want to give you another source that's going to be very important when you've broken a bone, but also important for bone health because it is 1/3 of what our bones are made of. And so find a really good protein source. And I think in order to get your high amount of protein, you really do need to get it in a powder. You certainly can keep taking your animal or vegetable sources of protein, but you really need a good protein powder as well. So eating foods high in protein will give the body amino acids it needs to produce keratin. We've talked about how important keratin is for our nails and our hair. And then so many times when you've broken a bone, you're going to end up with surgery. So the fact that you've broken a bone is traumatic on its own. But then if you add surgery, doctors will tell you shock, infection, or surgery will double and triple your needs for protein. So remember that people were deficient in protein to begin with if our bones aren't healthy, but then breaking a bone is going to dramatically increase our need for protein. Protein is needed not just for the health of our bones, but it's required to form antibodies, synthesize collagen, and rebuild damaged tissue. My recommendation would be to use 3 servings of Veggie Pro. We have a lot of different protein powders. They're all considered non-denatured, which means they're processed at a very low heat because heat has, unfortunately, the capacity to kill so many of the nutrients. So whether you choose Veggie Pro, Whey Pro Complete, SP Complete, you can choose. The reason why I'm mentioning Veggie Pro here is because it gives you the highest amount of protein per serving. and 3 servings of Veggie Pro, you'll get 96 grams of protein. And you're going to need at least that much with a broken bone, especially if you're over the age of 50. The next product that I want to talk about is gotu kola complex. Gotu kola complex is a combination of gotu kola, grapeseed, and ginkgo. It's about 15 times stronger than comparable capsules. And I'm going to show you how and why I came to that conclusion. So please, when you're looking at a MediHerb label, especially, forget the right-hand side, this side. Don't look at that part at all. Look at the left-hand side, because this is where it tells you the reality of what you're getting in each caplet or tablet. So with gotu kola, you're getting 2.5 G, that's 2.5 grams. That's equivalent to 2,500 milligrams. If you were to get a capsule of dried gotu kola leaf from a health food store shelf, the most it would have in a gelatin capsule is 400 to 500 milligrams. This is 2,500 milligrams. So they've taken 2.5 grams or 2,500 milligrams, they've turned it into a 10-to-1 extract. So the 250 milligrams is of that 10-to-1 extract. So look at the starting amount. And that's why MediHerb works so well, because the potency is so much higher than what you're going to get elsewhere. They may be they may seem expensive, but when you start breaking down the cost, you'll understand that they're actually quite valuable for what you're getting. The grapeseed, it's the same thing. You're getting 3.6 G, which is 3,600 milligrams. And the ginkgo leaf is 1 gram or 1,000 milligrams. So what I wanted to do is break down why these are so good for broken bones. Gotu kola is the most extensively studied herb in clinical management of the healing process, especially for cartilage and connective tissue repair. It improves healing rates post-surgery, improves microcirculation, and it improves wound healing. Studies report an acceleration of the healing process, especially in terms of the production and strength of connective tissue. Remember, our bones are special mineralized connective tissue. Oral administration of gotu kola reduced joint inflammation, cartilage erosion, and bone erosion. Also great for arthritis. Here is a clinical study on grapeseed extract, which increases bone callus formation and mechanical strength. So this is taken from the Journal of Orthopedic Surgery and Research. And what bone callus formation is, that's the bridge process that the body goes through when you have hurt yourself, when you've wounded yourself, and in this particular case, broken a bone. It's a type of bridge that the body uses, a special connective tissue, to start to bind the pieces of separated bone together. And the fact that grapeseed extract in the gotu kola complex is going to do that, that's why I'm recommending it for broken bones. And I thought this was interesting. They found that the bone healing was more prominent in groups that were supplemented with a grapeseed extract. There was a statistically significant improvement in recovery scores and callus volumes in groups with grapeseed extract. It found that it increased bone strength, not only in fracture groups, but also in the positive control group. So it's going to make your healthy bones a lot stronger. Ginkgo biloba. We don't tend to think of grapeseed extract or ginkgo biloba for our bones. We tend to think of both of those products for our brain, but it happens that ginkgo is also very good. So here's a 2017 study that shows that ginkgo improves bone formation during fracture healing. And it's doing this by improving circulation. and oxygenation, which is considered one of the most important factors for fracture healing. Suggested use for gotu kola complex, 3 to 6 daily for 3 months. And I'm recommending 3 months, at least 3 months, because you need that much to make sure that your bones are healing properly. And as far as the safety of gotu kola complex, except for the rare person who's allergic to gotu kola, no adverse effects have been found with it. As far as grapeseed extract, it's generally well tolerated when taken in moderate amounts. And grapeseed and ginkgo possibly are considered unsafe if you have a bleeding disorder or you're taking anticoagulants such as warfarin or aspirin. And if you have any questions specifically about them, feel free to let me know. Another product that I think is critical for bone health and broken bones is MediHerb nettle leaf. So this is a liquid, and I will tell you it's not bitter. It does not taste bad at all. I actually use it externally as well as occasionally using it internally. And I just taste it straight. I don't mix it with water, and it's very easy to take. You'll find it's pretty neutral. Very important for hydration and as a source of protein. So we've got 2/3 of our bone health taken care of with nettle leaf. But then we've got the third portion of the 3 because it's an excellent source of living silica and boron. Okay, so we may think of silica as a homeopathic silica. Homeopathic silica is taken from silicon dioxide, which is the kind of inert form of silica that's found in the ground. But the form of silica that's found in nettle leaf is the nettle takes the silicon dioxide from the earth and it takes it up through the entire plant, and it ends up in the tiny little hairs on the leaves of nettle leaf, and you get living silica and boron found here. Very important. Silica and boron are going to be important for bone density, bone flexibility, crucial for repair and recovery. Because silica builds collagen, it does a lot more than strengthen bones and joints. So again, nettle leaf also will provide all 3 components for building strong, healthy bones. And again, it does a lot more than strengthen bones and joints. It reinforces structure of hair and skin. Silica ensures the connection between collagen and proteoglycans. So what they do is they link with collagen and make collagen-rich structures more resilient and bind water for better hydration. Again, another aspect, 1/3 of our bones is water. So we need things that are going to help hydrate us. I thought this was interesting too, that boron will actually stimulate bone growth in vitamin D deficient animals, because we know vitamin D is important too, but this actually helps with vitamin D deficiency, will help our body make vitamin D. And it plays an important role in osteogenesis. Again, this is the formation of new bone. Deficiency of boron has been shown to adversely impact bone development and regeneration. Greatly improves wound healing. These are some of the other beneficial effects in the study. It just goes on and on and on as far as the wonderful aspects of boron. I just put a few in here. The beneficially impacts our hormone, helps with vitamin D, which we've talked about, boosts magnesium's absorption, reduces inflammatory biomarkers. So we're going to be inflamed if we've broken a bone. The fact that it helps reduce C-reactive protein and tumor necrosis factor. Raises our antioxidants as well. I put this in here just because I love nettle leaf, again, because it's a source of silica, but it's also going to be excellent, not just to take internally, but use externally. So here is my Skin Vibrancy Tonic. You can also look on my website, kimsberryconsulting.com. just type in the little search box, skin tonic, and the recipe will show up. But again, I love it for taking it externally. Okay, so here's my broken bone tonic. Since our main focus today is broken bones, highly, highly recommend 6 calcifood wafers or 1 tablespoon of calcifood powder, 6 Calma Plus. You need to take those together for 3 months. When you take 6 Calma Plus 6 calcifood wafers, you're getting 900 milligrams of highly usable calcium for rebuilding the bone. In addition, you'll want to take 3 servings of Veggie Pro a day or your favorite protein. Make sure that your protein, whatever it is that you're using, is a really good, non-denatured, real high quality protein. 3 to 6 gotu kola complex a day, and 1 heaping tablespoon of the nettle leaf per day. And that's all that I have for you today. And I see that we have some questions, so I'm going to take a look at those first, since Sharon needed to leave early. So address vitamin D and fatty acids. So of course, fatty acids are certainly important. One of those products is actually rich in fatty acids, and I cannot recall which one. But yes, we've already addressed vitamin D. Do they need to be taken at the same time? Not necessarily. They can be, but not necessarily. Should we use both calcium lactate and calcifood every day? Yes, you can certainly do that. And that's what I'm doing. I don't take my calcium lactate powder every single day, but I take it most days. And I usually take it in the form of powder, and I take it at night because it helps me sleep so well. Let's see. I have a couple of clients who are menopause age, and even though I'm using supplements, they're becoming osteoporosis. Again, I think this is going to be really a great start for anyone who has bone issues, because this is going to help with osteoporosis as well. What's the difference between collagen and gelatin powder and calcifood? I would depend on what it is. So please feel free to let me know. If it's a really high quality, low temperature collagen gelatin powder, it may be fine to take. But again, I would still take it along with calcifood, because you're going to be getting so much more than collagen and gelatin in the calcifood wafers. Should parathyroid be tested before supplementing? Sure, you could do that. Or if you know of someone who has a thyroid issue, chances are the parathyroid will be affected by that as well. I heard that too much protein interferes with calcium utilization. That can be true. Again, the type, and this goes for everything that we're talking about, the type of protein needs to be digestible. And the protein that I'm recommending is going to be highly digestible. And again, when you've broken a bone or suffered trauma or have had surgery, your need for protein will double and triple. So you have to make sure you're getting enough protein. And I think that's it.